Bismillahirrahmanirrahim. Assalamu alaikum. Today our topic is respiratory system. As you know that the respiratory system does very important roles in our body. It's bring oxygen into our body which we need for our cell to live and function properly. The respiratory system is also important. It helps us to get rid of carbon dioxide, which is the waste product of cellular respiration. The learning objective to our today topic is don'ts of respiratory system, the organ involved in respiratory system, structure and function of nose and nasal cavity, blood supply of the nose, and clinical anatomy point and importance of nose as a clinical point of view. The respiratory system is divided into two zones. The first one is conducting zone, another is respiratory zone. As the name showed that the conducting zone, the airway which conduct the gases. It include nose, nasal cavity, pharynx and trachea. Respiratory zones. The respiratory zones, the area of the respiratory system where the gases exchange take place. It include bronchioles, alveolar ducts and alveoli. The muscles of the respiratory system include diaphragm and that promote the ventilations. The respiratory system is divided into two parts, upper respiratory tract and lower respiratory tract. Upper respiratory tract include nasal cavity, pharynx, larynx, and the lower respiratory tract include trachea, primary bronchi, bronchioles, lungs, alveoli, etc. The major events which took place in the respiratory system include pulmonary ventilation, external respiration, internal respiration, and transportation. Pulmonary ventilation is the moving the air into and out of the lungs is known as pulmonary ventilation. External respiration, the gases exchange between the lungs and blood is known as external respiration. Internal respiration, the gases exchange between the blood vessels and tissue. And transport, it's the transport of the oxygen and carbon dioxide between the lungs and tissue is known as transports. The first organ of the respiratory system is the nose. The nose is the part of the respiratory system that extended from the superior to the hard palate. It also contains the organ of the smells. The nose is divided into two parts, external nose and nasal cavity. The external nose is composed of different types of cartilage, and nasal cavity is divided into right and left cavity by the nasal septums. The major function of the nose is olfactory functions, respirations, filtration of the dust particles, humidification of the inspired air, etc. External nose. The external nose include, as you show in the diagram, root, apex. The root and apex is known as dorsum, and the right and left nares, and the part that divide the right and left nares is nasal septums, and the area around the nasal septum is known as ala. The area below the apex of the nose is known as philtrum. As you show in the diagram, the part of the philtrum, apex of the nose, dorsum nasi, root and the bridge of the nose. External nose. The visible part of the nose that show on your face is known as external nose. It made of different type of cartilage. The part of the external nose that extends from the root of the nose to the apex of the nose is called dorsums. The inferior surface of the nose is pierced by two piriform openings known as nostrils. The superior bony part of the nose, including its root, is covered by the skin, and the skin over the cartilaginous part of the nose is covered with the thicker skin which contain many sebaceous glands. The cartilage by which the external nose is formed is alar cartilage, lateral side of the nose, medial side of the nose, membranous cartilage, nasal spines and septal cartilage. The skin extended into the interior part of the nasal cavity is known as vestibule. The vestibule of the nose contains the various types of the hair particles which include for filtration of the air is known as vibrissae. The skeleton of the external nose is from bones and cartilage. The bony part consists of, as we show in the diagram, nasal bones, frontal process of the maxillary bone, nasal part of the frontal bone, nasal spines, bony part of the nasal septums. The cartilaginous part of the nose consists of the 5 main cartilages, 2 lateral cartilage, 2 alar cartilage and 1 septal cartilage as you previously show in the diagram. The U-shaped alar cartilage are free and movable and they dilate and constrict the nares when the muscle acting on the nose contract. The nasal septum is further divided into the 2 nasal cavities. The one is bony part and other is movable cartilaginous part. The component of the nasal septums include perpendicular plate of the ethmoid bone, vomer bone, nasal spine of the frontal bone, nasal crust of the sphenoid bone, nasal crust of the palatine bone, and the nasal crust of the maxilla and septal cartilage. The perpendicular plate of the ethmoid bone, vomer, crust of the maxillary and the palatine bone form the bony part of the nasal septums, while the septal cartilage form the cartilaginous part. The thin perpendicular plate of the ethmoid bone forming the superior part of the nasal septums. It descends from the caribriform plate. As you show in the diagram, this caribriform plate is further divided into two portions, which is included into the olfactory process and respiratory area. The superior 1/3 of the nasal mucosa form the olfactory area and the inferior 1/3 of the nasal mucosa form the respiratory area. The nasal cavity is entered interiorly through the nares, the posteriorly into the nasopharynx through the conchas. As is shown in the diagram, the nasal cavity is divided into 2 parts, olfactory region and the respiratory region, and previously opened into the nasal pharynx through the different type of concha: superior nasal concha, middle nasal concha and inferior nasal concha. The boundaries of the nasal cavity. The nasal cavity is divided into different type of boundaries: roof, floor, medial wall, lateral wall. The roof. The roof of the nose is curved, narrow, except its superior end. It divided into different parts, 3 parts: frontal nasal, ethmoidal, sphenoidal. The name of these 3 parts are given according to the bone attached to this part. The floor. The floor of the nose is wider than its roof. It is formed by palatine process of the maxilla, horizontal plate of the palatine bone. Medial wall of the nose is formed by the nasal septum. The lateral wall of the nose is irregular owing to the 3 bone plate nasal concha which projected inferiorly. The feature of the lateral bone include following. The lateral wall of the nasal cavity include a curve inframedially. It include the conchas: superior nasal concha as we previously shown in the diagram, middle nasal concha and inferior nasal conchas. As I have told you about the opening of the nose, interior as the nostrils and the posterior into the nasopharynx, and it also include the different type of the sinuses: frontal sinuses, ethmoidal sinuses, sphenoid sinuses and maxillary sinuses. The function of these sinuses is to resonate of the voice and also reduce the skull weight. The inflammation of these sinuses cause the severe type of sinusitis, which is the inflammation and the swelling of the mucosa of the one and the more of the paranasal sinuses. The nasal cavity is thus divided into the 5 passages. The first one is posterior superiorly placed sphenoethmoidal recess, and the further is divided into the lateral superior, middle and inferior, and the medial place common nasal meatus into the 4 lateral passage opens. As you show in the diagram, the 3 projection nasal conchas, superior, middle and inferior nasal conchas. The space below this nasal conchas is known as meatus, and the space above this nasal concha is known as the sphenoethmoidal recess, as you show in the diagram. In nasal cavity, there are the three type of meatus: superior meatus, sphenoethmoidal meatus, medial meatus, and inferior meatus. These meatus are shown when the conchas are removed. Each nasal concha with surrounding structure is formed the recess and meatus, which underlying each of the conchas. The first one is inferior conchas. The inferior concha is the longest and the broadest and is formed by the interdependent bone, covered by the mucous membrane that contains the large vascular space. When infected or irritated, the mucosa may be swelled rapidly and blocking the airway passage on their dead side. That causes rhinitis. Sphenoethmoidal recess. Lying superior or posterior to the spiral concha, it's received the opening of the sphenoid sinuses and the air-filled cavity in the body of the sphenoid bone. The superior nasal meatus, the meatus, as I have told you about, the meatus is formed when the concha is removed. The area below the conchas is known as meatus. The meatus is the small passageway. It's the narrow passage between the superior and middle nasal conchas. The middle nasal meatus is the longer and the deeper than the superior one. The anterior superior part of this passage lead into the funnel-shaped opening. The ethmoido-infundibulum through which is communicated with the frontal sinuses through the passage known as the frontonasal duct, as you show in the diagram. As you show in the diagram, the frontal sinuses and its opening into the ethmoidal bulla in the middle meatus formed by the middle ethmoidal air cells. The maxillary sinus is opened into the semilunar hiatus. As you show in the diagram, the semilunar, its name is as moon-like shape of the hiatus, that is it known as the semilunar hiatus, with the opening of the frontal sinuses, maxillary sinuses, and interior and the middle ethmoid air cells. The inferior nasal meatus is the horizontal passage of the infralateral to the inferior nasal concha. The nasolacrimal duct, which drained the tear from the lacrimal sac, opened into the interior part of his meatus. These interior, superior and inferior meatus, there is a common nasal meatus, is the medial part of the nasal cavity between the concha and the nasal septum, into which the lateral recesses and the meatus opens. As you show in the diagram, the superior conchas, medial conchas, and the inferior conchas. And when these conchas are removed, they are shown different type of meatuses. The first one is posterior ethmoid cell opening into the wall of the superior meatus. Another is phytosinuses opening into the phytoethmoidal recess. Another is middle ethmoid cell opening into the ethmoidal bulla, and the semilunar hiatus opening of the maxillary sinuses. Inferior meatus, infundibulum opening of the frontonasal duct, nasolacrimal duct of the opening, and inferior conchas. This all about the anatomy of the nose. Then the function of the nose is the superior part of the nose is involved in the respirations. Its passage for the airway, it's filtered the air and become the air warmth and humidification. The nose is also further divided into the olfactory region, which help for the detection of different type of the smells. The nose is also help in phonitation for the production of the sound. The nasal cavity also receives the secretion from the paranasal sinuses and secretion from the nasolacrimal duct. The conchas in the nose increase the surface area, that increase the area for the inspired air over the whole of the nasal surfaces. The large surface area maximizes the warming and the humidification and the filtration of the air. The nasal cavity also causes the irritation of the nasal mucosa, resulting in the sneezing and the reflexation that forcefully expel and irritant, which is the positive sign for respiratory system. The no foreign particle is entered into larynx. The blood supply of the nose in medial and the lateral wall of the nasal cavity. The blood is supplied by arterial ethmoidal artery, posterior ethmoidal artery, which is the branch of the ophthalmic artery. Spinopalatal arteries, great palatine artery, which is the branch of the maxillary artery. Septal branch of the superior labile artery, which is the branch of the facial arteries. Include these arteries, they form a complex plexus area in the nasal septums where the richest blood supply in this area. The plexus which is formed by these arteries known as Castle-Belch area. As you show in the diagram, the different type of the arteries form a plexus is known as the Castle-Belch plexus. The venous return is through the sphenopalatine, facials and the ophthalmic vein. The nerve supply of the nose is through olfactory nerve. The Castle-Belch plexus is the vascular network of the 4 arteries that provide the rich supply to that area. These arteries are anterior ethmoidal artery, sphenopalatine artery, greater palatine artery, septal branches of the superior labile artery, which is the branch of the facial artery. The clinical importance of this Castle-Belch plexus is it causes the epistaxis when the blood supply of the area is rich, and it causes the trauma, and the bleeding from this area is known as epistaxis. There is another reason for the epistaxis: increase hypertension, increase infections, and the different type of the nose irritations. The another importance of nasal septums is rhinitis. As the name shows, then tis mean inflammation. The rhinitis mean when the nasal mucosa becomes swollen and inflamed during the severe upper respiratory tract infection is known as rhinitis. For any query, contact at that email address and contact number. Thank you.